I do want to talk a little bit about phenylketonuria, or they'll also call it PKU. This is a disorder, it's a metabolic disorder caused by an autosomal recessive trait. It creates a deficiency in the enzyme phenolphthalein hydrolase. The absence of this enzyme impairs the ability for the body to actually metabolize that amino acid. And that particular amino acid is found in all proteins. So what happens is the patients will become toxic in the blood, and this interferes with brain development and function. So what is going on now, all babies that are born will get a PKU test done. It's a heel stick in which they obtain, I believe, 6 drops, 6 circle size, like probably about a penny size of blood. And when you guys go to your mother baby clinical, you'll see them doing this test. They do it 24 hours after the baby is born, because the goal is that we want to test the baby for this disorder. We want to diagnose this, and we want to get them on a restricted phenolphthalein restricted diet, because this decreases the incidence of cognitive impairment. But this is something that mom can also have too. And so I just wanted to bring that out, because it is one of those disorders that you're going to see, and we don't always see it if we talk about it affecting mom and affecting baby. Okay, so from page 284 to 290, it kind of goes through the different disorders. Cardiovascular, it goes through thyroid, it goes through, I think, pulmonary disorders. It goes through a lot of different disorders. Those disorders are important. You guys are going to get more information on those disorders in Med-Surg. So I do not want you to focus on those disorders for mother-baby. Right now we're trying to establish some of the just basic normal elements of pregnancy and the highest risk of complications. These moms can come in because moms are waiting later to have children, so when they wait later to have children, they come in with more disorders. So they do have a big influence on mom and baby. So just be aware of that. I do not want you to focus hard on these pages. So you can glance at them, and there you go. That will take care of it. The biggest thing, though, I want you to know about cardiovascular, because that is a big component, and I have seen many moms end up in cardiomyopathy after they deliver their babies, is that with the cardiovascular system, we talked about in NUR 226, I think, a little bit, that moms who are pregnant have an increase in their intravascular volume, a decrease in their systemic volume resistance, and they have a change in their cardiac output. Out of all the disorders that are talked about under the cardiac system component, your mitral valve prolapse is the most common, and it is benign in comparison to the others. Out of what I really need you to know as far as cardiac goes is in, let me see the page. The box is 11-3. And the page is 288. The potential complications of cardiac decompression. You guys need to know these signs and symptoms. You need to know what you're going to observe as the nurse. You need to know what the patient is going to say to you, because these are key. And I can tell you, in the postpartum world, they happen quickly. Patient teaching is also a key. So you want to think about it, different things that you want to tell this patient to do. Daily weight. Making sure that they're going to their appointments. Trying to stay active. Letting them, or the physician know if they have increased fatigue, shortness of breath, a cough. So those two boxes are the most important that I really want you to look at and be aware of. We're going to talk about substance abuse. One of the things that are key for patients who have substance abuse. You, as the nurse, your responsibility is not there for judgment. Your responsibility is to take care of baby and to mom, and we want to have the best optimal health possible. We want both of them to be safe and healthy. Education and patient teaching is key until you're blue in the face. Laboratory studies that may be done. These moms are going to be tested for STIs, gonorrhea, chlamydia, syphilis. They are going to also be tested for hepatitis B and C and HIV. We want to individualize the treatment. It also depends on the type of drug. If we have moms who are abusing alcohol or in alcohol withdrawal, they're going to get Librium, Valium, and Ativan, and Cererex. You guys may have remembered this if you did your simulation over the summer. We had an alcoholic patient that we took care of, and he was receiving some of these medicines. The other thing to know, though, for pregnant moms, they do not get antabuse because it is teratogenic. Methadone maintenance be used. This is standard for pregnant women who are dependent on heroin and other narcotics. They also, you need to be aware of that if moms are on methadone maintenance in regards to babies end up in a higher risk of having neonatal abstinence syndrome or NAS, and they usually require to be on some type of medication after they're born. If moms are taking cocaine or methamphetamines, they are to stop them immediately. Now, breastfeeding is contraindicated in moms who obviously are taking amphetamines, alcohol, cocaine, heroin, marijuana. Methadone is not contraindicated. If mom is on methadone, she can breastfeed her baby, more than likely because the baby's also going to be on methadone too. Smoking interferes with the letdown reflex in regards to breastfeeding, so that just means that mom has issues and her milk does not come down, so she's not able to maybe feed baby adequately. So if moms are smoking, what they recommend in the postpartum period is she avoids smoking 2 hours before feeding. That will help a little bit. The other thing, your textbook talks about screening with the 4 Ps. The 4 Ps are parents, partner, past, and pregnancy. That's on page 298, box 11-4. And then there's a box 11-5 on page 299 that just talks about dealing with pregnant substance abusers. And as the nurse, what is some of your responsibility and how you should react to these patients. And that concludes our chapter.